Hi, I'm Dr. Matin Mellor. I'm a consultant in clinical oncology and radiotherapy in Subang Jaya Medical Center in Subang Jaya. Today we've talked about breast cancer, and breast cancer is a cancer that's totally treatable and curable and beaten if you diagnose it early. So if you have any of the early signs of breast cancer, lumps of breast cancer, do consult your doctor immediately. And you are listening to Mag from AFO Radio.
Good afternoon, welcome to AfoRadio.com. You are with Mag and Dr. Matin Mellor from the Subang Jaya Medical Center. He's a consultant in clinical oncology and radiotherapy. We're talking about breast cancer this afternoon. It's time for us to do What's on Your Mind. Doctor, are you ready?
Yes.
Okay, so tell us 3 things that people must absolutely know about breast cancer.
Number 1, it occurs in women.
Stating the obvious, doctor.
That's right. Yes, because in women. And number 2, it may run in family. Number 3, if you pick it up and treat it early, it's curable.
Okay, very good. Now, 3 myths surrounding breast cancer.
The myths surrounding breast cancer, Well, I think one of them is that breast cancer is contagious.
Really?
Yeah.
Okay.
And the breast cancer can be made worse by intimate relationship with the partner.
Okay.
That's one of the other myths. And the other myth, of course, is it's a death sentence.
Okay.
Yeah.
All right. Now, 3 things a person should remember when diagnosed with breast cancer.
When one is diagnosed with breast cancer, it's important to sit down, recap, and regroup your thoughts to be able to manage the cancer in a very systematic manner.
Okay.
You can go for a second opinion if you're not so convinced about the diagnosis. Go for a second opinion. If you need to go for a third opinion, go ahead for a third opinion before making any decision as to what to do. And although it's recommended you go for multiple opinions, it's important that you do that speedily.
Okay.
And don't delay.
Okay. Yeah. 3 most effective means of treatment for breast cancer.
Well, there are 5 means of treatment for breast cancer. There is surgery, there's radiation therapy, there's hormonal therapy, there's targeted therapy in the form of Herceptin. There are also, in some high-risk individual, adjunctive therapy in the form of bisphosphonates may be useful.
Okay. And how does all these measures or rather means of treatment, how does its side effects affect you in the long run?
Well, the side effects are different. Every modality of treatment, the side effects are different. The side effects of chemotherapy, of course, is fairly well known: nausea, vomiting, hair loss, risk of infection, so on and so forth. And one of the longer term side effects that people do complain about is numbness of the fingers. They get numbness, they can go on for many months. And this phenomenon called the chemotherapy brain syndrome, where they tend to forget.
Okay.
They become very forgetful. And generally the timing of that will be, worse during the chemotherapy, after the chemotherapy, and sort of normalizes after about a year.
Okay.
Of course, radiation therapy, depending on the area you radiated, then the skin might become a little bit thin, skin might become pigmented, but again, that's reversible.
Okay. Now, going on to the first thing that comes to your mind when I say a series of words, tell me the first thing that reminds you of what I say, okay? Cancer.
Breast cancer.
Breast cancer.
When?
If I say breast cancer, what's the first thing that comes to your mind?
Curable?
Cure.
Cure, yeah.
Yeah, so when I say cure, what's the first thing that comes to your mind?
Cure in breast cancer is possible,
Okay.
especially if diagnosed early.
All right, what about treatment?
Treatment, there are 5 modalities of treatment, but you may not need all of them.
Okay, what about hope?
It's good to hope because that gives you motivation to go on with the treatment.
All right, support.
Support from family is important. If a patient is married, support from the husband is extremely important. From the children, from the extended family are very important. And little things are very, very useful. For
Okay.
example, offer to cook, offer to wash, the usual things that people do at home, ironing clothes. Those are very most welcome.
All right. Love.
It's important to maintain love during the time when a person is diagnosed with breast cancer, having difficulty during breast cancer and treatment because of the changes in the body image. It's important to remain together and maintain oneness as completely as possible.
Okay. Life.
Need to be treasured.
Okay. Family.
Need to be maintained.
And your last words for our listeners this afternoon.
Breast cancer is not a death sentence. Breast cancer, if diagnosed early, is certainly treatable and it can be beaten.
Okay.
And many women would testify to that fact.
Wonderful. Thank you so much, Doctor, for dropping by this afternoon. We've learned a whole lot of things about breast cancer. So thank you, and I wish you a wonderful day ahead.
Thank you, Meg.